Hello and welcome to yet another episode of Meet the Masters. This is me, Anjali, here with you. In today's show, we do have a special guest with us. She is the President and Chief Clinical Psychologist at Texas Medical Concierge. Let us welcome Ms. Aanchal Bhatia to the show. Welcome, madam.
Thank you so much for having me here.
So, before going deeper into the subject of medical tourism, we would like to know how and when you found your interest in this field.
That's a very interesting question and a personal question. It started off with a personal experience when we were nursing for my father-in-law. We came up close with the realities of healthcare and the challenges people face. At that point, we realized how hard it is for people to navigate the world of healthcare. And that's exactly what we wanted to start doing, is to give access to global quality healthcare, is to navigate healthcare and facilitate the whole healthcare process for people.
Okay. And coming to your company, what does exactly Texas Medical Concierge do?
Okay. So Texas Medical Concierge, we like to feel, is the first of its kind in the world. We are trying to provide world-class healthcare at your doorstep. And the way we are doing it is through telemedicine, and the services that we are providing is international medical travel. So anybody who's wanting to travel across borders for healthcare, it could be to India, it could be from India, it could be to US, it could be from the US. We work with multiple countries like Thailand, Singapore, Germany, and the UK. So we facilitate cross-border medical travel. A large part of what we do is facilitate medical second opinions.
Okay.
Very often people don't know where to go and how to go about getting a medical second opinion. They're too dependent on their primary physician who's taking care of them, or by word of mouth. So they will call up a relative and say, could you suggest me a doctor for this, or could you get me a second opinion for this? And it's not the right way to go about it, because this is a world of super specialization. How does your relative know the disease-based specialist who's right for you? So we go about it in a very scientific, in a very systematic way, where we find and we match a physician to the client and we help them get the second opinion. The other thing that we do is we have a very detailed process of getting to know our clients and to give them holistic health options. So it's not only the modern medicine doctor that we'll find for you, we will also find you the right alternative medicine specialist, whether it's the best of Ayurveda or yoga. We work with institutions that are doing research. Okay. And we give international quality of integrated medicine to our clients. The other thing that we're doing is personalized medicine. Today is really a day and age where your body and my body is not the same. How will that centrum help you in the same way it's going to help me? So it's all about customization, it's all about personalization.
Okay, could you tell us more about the whole process of telemedicine?
Okay, so telemedicine, what is telemedicine first? You know, it's a big jargon, it's a big word. It's basically telecommunication plus information technology. So when you combine healthcare IT and video conferencing and sophisticated telecommunication together, you get telemedicine. And how we are using telemedicine is not very different. It's been used since the 1950s. We are using it to provide better quality healthcare, and we're using it at various steps. So when a client comes in, again, I mentioned again, I come back, we have a very detailed health history taking process, which is 2 hours long, where we get to know the client. We consolidate all their medical records. So we take every handwritten prescription, every hard copy X-ray or MRI or any digital films that they have. We put them on our own electronic medical record software. We digitize it, and we use, again, we're using telemedicine for transmitting all this medical data, after which it converts into a video consult. When we do the video consult, we have these cutting-edge, sophisticated peripheral medical devices. So if I put a stethoscope here, the doctor in America can hear it real time. Okay. I put a camera in your ear, he's able to see inside your ear, in your nose, in your throat. Okay. And there's a doctor on this end. So you have 2 doctors looking at you microscopically through these fantastic sophisticated cameras and peripheral medical devices. So in many respects, it's a more superior consult to a face-to-face consult that you'd have with the doctor if he happened to be in your city. So we're using it for this level of sophisticated clinical interactions between the doctor and patient. After that, it's also very useful for continuity of care. So for example, if you've gone overseas, you've got a procedure done, you've got your surgery done, you come back and the doctor wants to have a follow-up appointment with you. You don't have to travel back. Again, through this sophisticated telemedicine technology, you're able to have the follow-up consult. We have sophisticated dermatology scopes, wherein even the smallest, scars can be seen, and everything could be monitored virtually.
Being a healthcare entrepreneur, what challenges and issues are you facing right now?
Challenges in an entrepreneur's life are constant. I mean, starting a new business is always a challenge. Being the first of its kind is always a challenge.
Yes.
But this is not my first startup, so challenges are a constant, and they're part of the business launch process, which is fine. But particularly if you speak within the domain, medical tourism is a highly abused word, and we are not trying to fit into the medical tourism world. We want to provide sophisticated medical travel concierge services. So defining that term is a challenge, because it's something new. Trying to explain to people what we are doing and how we're doing it, I guess it's going to be a long journey, but we're not in this for the short term.
Okay. What other services do you provide to these international patients?
Okay, so again, concierge, the term is very wide. So the process starts with first digitizing their medical records, sharing the medical records with super specialists, then going back, and the back and forth communication that happens between the treating physician in the home country and the specialist in the country in which you're going to be traveling to. So all that medical data management is what we do. We also have services like receiving the patient at the airport, depending on what the client wants. A lot of these international offices do take good care of certain aspects, and we don't want to duplicate those services. Everybody has travel agents, everybody has hotel bookings, so until and unless they want us to go and check out the room for them and to see, is it wheelchair compatible, do they have hand rolls in the showers, or personalize the room with something from their home country, like maybe some grocery ingredients or the movie channels, or wherever that extra edge is needed, we supplement the international offices with what services the client might need. But really it's end to end. Whatever, we are their home away from home. So it depends on what their need is. It could be shopping, it could be visiting a place, and we will do that. But we are not getting them there for tourism. Yeah. It could be delivery of pharmaceutical drugs to their place. It could be identifying a concierge doctor or attaching a case manager who takes care of them during their stay. So we also provide other services like getting diagnostic tests done. Certain tests are not done in the hospital that's treating you. They are better done in another facility. So guiding them, helping them navigate where to get which tests done, where to go for which aspect of their healthcare. For example, if a case goes into a hospital for 5 days, after that they don't need to be there 1 month to recover. They can move into a long-term acute care facility, or they could move into a rehabilitation setup where they could access home health care. So all those end-to-end kind of cares which are beyond just the surgical intervention or the procedure in the hospital.
What advices do you give to these medical tourists?
Well, I think what works for us, and this, if I had to give any words of wisdom, would be please represent your client, don't represent the hospital or the medical institution. Only words of advice to other medical travel facilitators and to other people in this line of business would be, please represent your client. The patient is trusting you with his life, his or her life. They are expecting you to make the right choice for them. And if that is the focus, everything else will follow. Again, yesterday at the conference, it was very beautifully said, always think of it as if they were your family, if they were your parents, if they were your family members, what is it that you would do for them? And if that is a focus, all the answers follow automatically.
Okay. What message would you like to give to our audience as such, when you think about medical tourism as
Definitely. People at large, I'd like them to open their minds and take individual responsibility for health. We all have choices. We all have more available now. The world is changing. All you need to do is step up, take responsibility for your health, and access those choices. It doesn't matter if you don't have all the super specialists within your same city, within your same country. Open your mind and make that change. You can really achieve, longevity is increasing, quality of life is really at its peak. Go out there and grab it.
And lastly, we would like to know your insights on medical tourism.
My insights?
Yes.
On medical tourism as a business, I think it's on crossroads right now. I'm only 6 months old in this business, but whatever limited knowledge I have is this whole industry is on a wrong footing. The foundation is wrong. It's run by mom and pop shops. It's run by fly-by-night agents. There are very few people who've been in this for a long time. There are very few people who are able to sustain in this. So my insight has been that it's been done with a very short-term view in mind. And that's my observation, but I'm sure it's going to change.
Okay. Thank you, madam. Thank you for spending your valuable time with us. It was a pleasure time with you. So that was Ms. Aanchal Bhatia with us. Until we meet next time, this is me, Anjali, signing off. Take care.